Hello everyone, myself Mansi Bhatia. Today I'm going to represent about assessment and management of encephalitis. So let's start. First of all, introduction to encephalitis. So what is encephalitis? It is inflammation of the brain tissue commonly caused by viral infections like herpes simplex virus, arbovirus and many more. Can also be autoimmune in origin and present with a range of neurological symptoms. Can lead to motor, sensory, cognitive and behavioral impairments. Now, what are the clinical features? That are fever, headache, altered consciousness or confusion may be present, seizures, behavioral changes would be there, focal neurological signs may be seen, cognitive and behavioral changes, coordination and balance problem will be there, and muscle tone abnormality would be there, that is spasticity and flaccidity will be there. So now we are starting with the assessment part, that is demographic data of patient should be necessary, history of illness and onset of symptoms, medical and surgical histories, current chief complaints, for example weakness, fatigue, coordination issue and all, right? Now we are going through the objective assessment in which first one is neurological examination, in which the level of consciousness, muscle tone and muscle strength will be measured. Now the reflexes in this patient having encephalitis may be having hyperreflexia or areflexia would be there. Coordination means finger to finger and heel to shine. All these tests would be performed. Sensory testing would be done. Cranial nerve examination would be done. Now cognitive and mental status, orientation, attention, memory, these all can be checked by MMS scale, that is mini mental scale of examination. And now posture and balance, in which static and dynamic balance test would be done. Gait analysis would be necessary. Respiratory status would be checked. All vitals should be checked properly first. That is chest expansion, breath sound, respiratory rate and all. Now functional evaluation, bed mobility, transfers, Barther index, NFIM scale and activity of daily living will be evaluated. Now goals of physiotherapy. What are the goals of physiotherapist? So first of all, prevent secondary complications related to the condition, improve muscle strength and coordination, restore functional independence of a patient, improve quality of life and support neuroplasticity and recovery. Now, physiotherapy management in first stage, acute stage, that is positioning to prevent pressure sores and contractures. Passive range of motion exercise would be done. Chest physiotherapy if respiratory involvement. Monitoring vitals during all interventions should be necessary. Now in subacute stage, active assisted and active range of motion exercise will be preferred. Facilitation techniques, that is PNF for motor relearning. Begin sitting and balance training, bed mobility and transfer training, cognitive stimulation if cognitive deficit present, and gait training we have to give, and functional retraining. The third stage is rehabilitation stage, in which strengthening exercise will be started, coordination and balance training, gait training with assistive device if needed, endurance training, functional training like grooming, dressing, toileting and every activity of daily living. Okay. Now occupational therapy for the ADL's independence and speech therapy if speech swallowing is affected. Now, what are the goals of electrotherapy treatment? It helps to stimulate weak or paralyzed muscle, prevent muscle atrophy, improve voluntary motor control, reduce spasticity if present, alleviate pain if present, enhance functional movement like gait and grasp. So we can give NMES, that is neuromuscular electrical stimulation, to strengthen weak muscles and prevent disuse atrophy. Then we can give functional electrical stimulation to assist in performing functional activities like walking or grasping. For pain management we can give TENS, and for improving voluntary muscular control and muscle activation we can give EMG biofeedback. Okay. Now the patient and caregiver education. Patient education is more important. We have to explain the condition to the patient, that what you are having and what you have to do after that. So the condition explanation will be there, home exercise program will be preferred, proper transfer techniques we have to teach, pressure shock prevention would be necessary, and fall prevention strategies we have to teach. Okay, so this is all about the assessment and management of encephalitis. Thank you.